Hello, I'm Dr. Sanket Mehta. I'm a surgical oncologist from SSO Cancer Center with a focus on cancers of the liver, GI tract, and the peritoneum. If you or someone close to you has been diagnosed with a liver tumor, whether it's a primary liver cancer or a cancer that has spread from elsewhere, you might hear two different treatment options, liver resection and ablation. These are both local treatments, but they work very differently. In this video, I'll explain how they compare, when we consider one over the other, and what patients can expect from each of them. Liver resection, also called as hepatectomy, is a surgical procedure to remove a part of the liver that contains the tumor. Depending on the case, this could mean removing a small wedge, a full segment, or an entire lobe of the liver. We usually choose surgery when the tumor is large, located deep within the liver, or when it's close to important structures like blood vessels. In many cases, resections give us the best chance at achieving long-term control or even a cure. And because the liver can regenerate, the part that has been removed often grows back over time as long as enough healthy liver tissue has been left behind. Liver ablation, on the other hand, is a non-surgical technique that destroys tumor right where it is without removing any part of the liver. We guide a thin needle into the tumor using ultrasound or CT scan guidance. Then, using energy, either radiofrequency or microwave, we heat the tumor until the cancer cells are destroyed. Some centers also use freezing, called as cryoablation. Ablation is typically used when the tumor is small, usually under 3 centimeters. It is located in an area that is easy to reach, and the patient may not be an ideal candidate for major surgery. This is a shorter procedure, recovery is quicker, and the risks are generally low. So how do these two options compare? Let's look at the key differences. Invasiveness. Resection is a major surgery. Ablation is a minimally invasive technique. Tumor size. Resection is performed for larger or multiple tumors. Ablation is often best used for small solitary ones. Recovery time. After surgery, recovery can take 4 to 6 weeks. With ablation, most patients are back to their feet within 1 or 2 weeks. Risks. Surgery carries risks like bleeding or bile leakage. Ablation has fewer risks, but there is a higher chance of tumor recurrence. Long-term control. In carefully selected patients, resection offers the best chance at long-term survival. But ablation is still very useful, especially when surgery is not possible. Choosing between resection and ablation isn't always very straightforward. It depends on a number of factors. We consider the size, number, and location of the tumor, how healthy the remaining liver is, whether the patient can safely undergo the surgery, and what other treatments like chemotherapy are part of the overall plan. Sometimes we even use both the approaches. For example, we might remove one part of the liver surgically and ablate a smaller lesion which is there in the remaining liver tissue. Every decision is based on what gives the patient the best outcomes with the least risk. Both resection and ablation can be effective, but the outcomes are different. Surgical resection tends to offer better long-term survival, especially in cases of colorectal liver metastasis or early hepatocellular carcinomas. That said, ablation still plays an important role, particularly for patients who are older, have other medical conditions, or have already had a surgery before. Neither approach is automatically better than the other. What matters is choosing the right treatment for the right patient at the right time. If you are facing a decision about liver tumor treatment, you don't have to figure it out alone. These choices are always made after a thorough discussion with the patient, the surgical team, the oncologist, and the intervention radiologist. I hope this video helped you understand how resections and ablations differ and how we decide between the two. If it was helpful, feel free to like, share, or subscribe so that others can find this information too. Thank you for watching. I'm Dr. Sanket Mehta from SSO Cancer Center.